I'm Dr. Jerry Hesch, a physical therapist at the Hesch Institute in Aurora, Colorado. And I just got a wonderful endorsement from a client. Something happened with the camera, I don't know what, but I wasn't able to offload it and he's gone. And so I'm rather disappointed because he was very, very pleased with his treatment for cuboid syndrome. Now this happens to be a right foot and ankle, and his presentation happened to be on the left side. But 5 years ago he tripped and injured his cuboid, and he had received treatment for it in the way of physical therapy and chiropractic care, and he had been treated 3 times with a cuboid whip, which is basically capturing the cuboid from the plantar surface, the undersurface of the foot, of the foot, and taking up the slack and giving a thrust maneuver. And this gave him up to 8 hours of relief. Now, what I believe is the reason why that didn't last him is because his subtalar joint, the joint below the talus, which consists of the calcaneus or the heel connecting to the talus, had lost motion, and it no longer moved into eversion, outward movement of the heel, and it no longer moved in abduction, outward rotation of the heel. And you can see that the cuboid is connected to the calcaneus, and it has a profound influence on the calcaneus. And so we unlocked the subtalar joint and restored subtalar eversion, which is part of pronation, normal pronation, and we restored abduction of the calcaneus, and at that point the cuboid was much freer. He had a little bit of tightness in the midfoot, and the midfoot also greatly influences the cuboid, particularly the navicula. And so we did some distraction mobilization and some rotational mobilization to the navicula. And in my speaking, I hope I didn't get my foot out of the camera angle. I'm the video person today. But we were very successful in treating that. He's very happy. And we taught him exercises to maintain the gain of motion of his cuboid, of his navicula, and of his calcaneus. And I think it's important when looking at the cuboid that we always test those other motions that occur with cuboid motion. And I think that will lead to much more successful outcomes. And the mobilization technique that I utilized to the cuboid was actually a plunge, or a cuboid drop mobilization. And I hope this is helpful to you. Thank you.